Ever wondered how to survive a heart attack and emerge stronger? Join me on a journey where I uncover the critical steps to surviving a heart attack. From identifying the signs of a heart attack in both men and women, because yes, they can vary, to understanding what to do if you're alone and experience a crisis of heart attack symptoms. This video is your comprehensive must-know guidance for life-saving knowledge. You will also discover the surprising role that reflexology plays in heart attack survival, alongside actionable tips to prevent a cardiac event. Don't miss out, your heart health depends on it. Watch this video to the end and empower yourself with life-saving strategies. A heart attack, also known as a myocardial infarction, occurs when blood flow to a part of the heart is blocked for a long enough time that part of the heart muscle is damaged or dies. This blockage is usually caused by a buildup of plaque in the coronary arteries, which are the blood vessels that supply oxygen-rich blood to the heart muscle. The plaque can rupture, causing a blood clot to form and block the artery. When the heart muscle doesn't receive enough oxygen-rich blood, it can lead to chest pain or discomfort, shortness of breath, sweating, nausea, and other symptoms. A heart attack is a medical emergency and requires immediate treatment to prevent further damage to the heart muscle and potentially save a person's life. Treatment may include medications to dissolve the clot, procedures to open the blocked artery such as angioplasty and stenting, and lifestyle changes to reduce the risk of future heart problems. Because I know that you find this video informative so far and will continue to find the rest of this video informational and very educational. Keep watching to find out what are the symptoms of heart attack for women, and yes, they experience some symptoms that are different from men. I'd like to take a moment to ask for your support. This is a simple, easy, but significantly very important favor. It will only take a few seconds of your time and will cost you nothing, but will help to grow my channel and also enable me to spread more valuable needed information like this. Now, please click on that thumbs up button. It's a simple act, but the impact can be massive. Imagine that simple click as a ripple in a pond, extending outwards to touch and influence others to become more conscious about becoming more informed about their health and well-being. It also helps to spread much-needed important information to a wider audience, which can potentially make a change in someone's life. So go ahead, show your appreciation for these types of informative videos. Click that thumbs up button to potentially make a change. Now, to ensure that you don't miss out on any more valuable content, click the subscribe button and the notification bell that is beside it. Then select all to gain access to all the other videos on my channel and to stay up to date with any new ones that gets posted. Most importantly, subscribing is absolutely free. My channel isn't just about sharing, it's about building a community of knowledge seekers who understand the importance of staying informed and updated when it comes to a healthy lifestyle. Here, you'll find a treasure trove of information on how to live a healthy lifestyle, including delicious, nutrient-packed recipes and tips on how to interpret the signs your body sends you when something's off balance. Subscribing and commenting not only helps the growth of my channel, but also enriches this platform by making it more interactive. Whether it's a question, a suggestion, or a simple greeting, your comments add to the dialogue. So go ahead, click that subscribe button and become a part of this knowledge-packed community. By the way, if you watch this video on your television, you can use your mobile phone or your computer to complete these tasks. Also, do not forget to leave a comment. It could be as simple as saying hi or where you're watching from. I would love to hear from you. Thank you for your support and participation in this community. Now let's delve into an important topic: recognizing heart attack symptoms in women. The signs can vary greatly between genders. Women often experience different or less typical symptoms compared to men. Here are some common symptoms that women may encounter during a heart attack. Chest discomfort. Unlike the classic crushing chest pain often associated with heart attacks, women may feel pressure, tightness, or discomfort in the chest that can come and go. It may feel more like squeezing, fullness, or pain. Upper body pain. This can be felt in one or both arms, the back, neck, jaw, or stomach. This pain can be gradual or sudden and may come and go. Shortness of breath. Women may experience difficulty breathing or feel short of breath even without chest discomfort. This may occur with or without exertion, nausea or vomiting. Some women may experience nausea, vomiting, indigestion or stomach pain during a heart attack. Sweating. Unexplained sweating, often accompanied by clamminess, can occur during a heart attack. Fatigue. Feeling unusually tired or fatigued, even with minimal physical activity, can be a symptom of a heart attack in women. Dizziness or lightheadedness. Women may feel dizzy, lightheaded or faint during a heart attack. Remember, not all women will experience all of these symptoms during a heart attack, and some may experience symptoms that are not listed here. Additionally, women may be more likely than men to delay seeking medical help or to attribute their symptoms to other causes, which can lead to delays in treatment. If you or someone you know is experiencing symptoms of a heart attack, it's crucial to seek emergency medical attention immediately. Be vigilant, be aware, and most importantly, take care of your heart health. Now that I've covered symptoms in women, let's discuss the symptoms men often experience during a heart attack. While there are similarities, it's important to note that there can be variations between genders. Here are some common symptoms that men may encounter during a heart attack. Chest pain or discomfort. This is the most common symptom in men. It may feel like pressure, tightness, squeezing, or burning in the chest. The pain can come and go or persist for several minutes. Upper body pain. Pain or discomfort may radiate to the arms, shoulders, back, neck, jaw, or stomach. It may feel like a dull ache, pressure, or tingling sensation. Shortness of breath. Men may experience difficulty breathing or feel short of breath, which can occur with or without chest discomfort. Nausea or vomiting. Some men may experience nausea, vomiting, indigestion, or stomach pain during a heart attack. Sweating. Profuse sweating, often accompanied by clamminess, can occur during a heart attack. Dizziness or lightheadedness. Men may feel dizzy, lightheaded, or faint during a heart attack. Fatigue. Feeling unusually tired or fatigued, even with minimal physical exertion, can be a symptom of a heart attack. It's important to remember that not all men will experience all of these symptoms during a heart attack, and some may experience symptoms that are not listed here. Additionally, men, like women, may delay seeking medical help or attribute their symptoms to other causes, which can lead to delays in treatment. If you or someone you know is experiencing symptoms of a heart attack, it's crucial to seek emergency medical attention immediately. Early intervention can help prevent further damage to the heart and improve the chances of recovery. Keep watching to find out what you should do if you experience any of the symptoms mentioned. In the event that anyone, regardless of gender, experiences symptoms of a heart attack, it's crucial to take immediate action. Here's what to do. Call emergency services. This should be your first step. If you are in the United States or Canada, dial 911. If you're elsewhere, then make sure that you contact your local emergency number. Remember, time is critical during a heart attack, and calling for help promptly can save a life. Chew aspirin. If you're not allergic to aspirin and have it readily available, chew and swallow a regular aspirin. Aspirin helps to thin the blood and can reduce the size of the blood clot causing the heart attack. Stay calm and rest. If you're the one experiencing the symptoms, try to stay as calm as possible and rest in a comfortable position. Stress and exertion can worsen the situation. Do not drive yourself. If you're experiencing symptoms of a heart attack, it's important not to drive yourself to the hospital. Emergency medical services can provide the quickest and safest transport, and they can begin treatment immediately upon arrival. Follow emergency dispatcher's instructions. If you call emergency services, the dispatcher may provide instructions to help you or the person experiencing symptoms. Follow their guidance carefully. Inform others. If someone else is with you, inform them of your symptoms and the actions you're taking. They can provide support and assistance while waiting for emergency responders. Have medical information ready. If possible, provide emergency responders with information about any medical conditions, allergies, medications, and previous heart-related issues. Heart attack symptoms can be similar to those of a panic attack, but it's better to err on the side of caution. Even if it turns out to be something other than a heart attack, it's important to seek medical evaluation promptly. Prompt treatment can make a significant difference in the outcome of a heart attack. Keep watching to find out what to do if you're alone and experience symptoms of a heart attack. If you find yourself alone and experiencing heart attack symptoms, it's crucial to act quickly. Let's walk through what you need to do. Call emergency services immediately. With your phone at hand, dial your local emergency number without delay. If you're in the United States or Canada, dial 911. If you're elsewhere, then make sure that you contact your local emergency number. Inform the dispatcher of your symptoms and your suspicion that you may be having a heart attack. Even if you're uncertain, it's always better to err on the side of caution. Chew aspirin if not allergic. If aspirin is accessible and you're not allergic, chew and swallow a regular strength aspirin, usually 325 milligrams, or 4-baby aspirin. Aspirin helps thin the blood and can reduce the size of the blood clot causing the heart attack. However, do not take aspirin if you are allergic or if a healthcare professional has advised against it. Stay calm and rest. Try to remain as calm as possible, resting in a comfortable position. Stress and exertion can exacerbate the situation. Practice slow, deep breathing to maintain calm. Signal for help. If you're in a public place, attempt to attract others' attention. You can shout for help or use any available means to signal your need for assistance. Call a neighbor or family member. If neighbors or family members live nearby, consider calling them to alert them of your situation and ask for help. Follow emergency dispatch instructions. If you've managed to reach emergency services, follow any instructions provided by the dispatcher. They may guide you on what to do while waiting for help to arrive. Do not drive yourself. It's imperative that you do not attempt to drive yourself to the hospital. Not only is it unsafe, but it can also delay treatment. Wait for emergency medical services to arrive. Remember, time is a critical factor during a heart attack. Taking prompt action can save lives. Even if you're alone, following these steps can increase your chances of receiving timely medical attention and the necessary treatment. Keep watching to find out what you should do to survive a heart attack. Surviving a heart attack doesn't end with getting to the hospital. After emergency treatment, there is a recovery process that is equally important. Let's walk through what you need to do. Receive medical treatment. Once emergency responders arrive, they will assess your condition and provide appropriate treatment. This may include administering medications or performing procedures to open blocked arteries, such as angioplasty and stenting. Hospital stay. You will likely need to stay in the hospital for several days for monitoring and recovery. During this time, medical staff will monitor your heart function and provide necessary care. Follow up with healthcare provider. After surviving a heart attack, it's crucial to have regular follow-up appointments with your healthcare provider. This is for further evaluation, monitoring, and recommendations for ongoing care and prevention of future heart problems. Cardiac rehabilitation. This is a medically supervised program designed for people who have had heart attacks or heart surgery. It involves exercise training, education on heart-healthy living, and counseling to reduce stress and help you return to an active life. Lifestyle changes. This includes eating a heart-healthy diet, regular exercise, quitting smoking, and limiting alcohol. If you have high cholesterol or high blood pressure, you will need to manage these conditions to prevent future heart attacks. Medication. You may need to take certain medications for a long time after a heart attack. These can help your heart work more efficiently and reduce the chance of future heart attacks. Emotional support. It's normal to feel scared, overwhelmed, or anxious after a heart attack. Seek support from loved ones or a mental health professional if needed. Don't hesitate to ask for help. Remember, surviving a heart attack requires not only immediate action, but also dedicated follow-up care. With the right steps, you can recover from a heart attack and reduce the risk of future heart problems. Keep watching to find out what you should do to prevent a heart attack and how reflexology can help with the recovery process. Now that we've walked through surviving and recovering from a heart attack, let's shift our focus to prevention. Preventing a heart attack involves adopting a healthy lifestyle and managing risk factors that contribute to heart disease. Here are some strategies to help prevent a heart attack. Eat a healthy diet. Nourish your body with a diet rich in fruits, vegetables, whole grains, lean proteins such as fish and poultry, and healthy fats like olive oil and nuts. Limit intake of saturated and trans fats, added sugars and sodium. Maintain a healthy weight. Being overweight or obese increases the risk of heart disease. Aim to achieve and maintain a healthy weight through a combination of a balanced diet and regular physical activity. Exercise regularly. Make time for regular physical activity most days of the week. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strengthening activities on 2 or more days per week. Quit smoking. Smoking is a major risk factor for heart disease. If you smoke, quit as soon as possible. Also, avoid exposure to secondhand smoke. Manage stress. Chronic stress can contribute to heart disease. Find healthy ways to manage stress, such as exercise, relaxation techniques like deep breathing or meditation, hobbies, socializing, or seeking professional help if needed. Control high blood pressure. High blood pressure or hypertension is a significant risk factor for heart disease. Monitor your blood pressure regularly and follow your healthcare provider's recommendations for management, which may include lifestyle changes and medication. Manage diabetes. If you have diabetes, keep your blood sugar levels under control through diet, exercise, medication, if prescribed, and regular monitoring. Control high cholesterol. High levels of LDL cholesterol, also known as bad cholesterol, can contribute to plaque buildup in the arteries. Follow a heart-healthy diet, exercise regularly, and take medications if prescribed to help manage cholesterol levels. Limit alcohol intake. Excessive alcohol consumption can increase blood pressure and contribute to other risk factors for heart disease. If you drink alcohol, do so in moderation. Get regular checkups. Schedule regular checkups with your healthcare provider to monitor your overall health and discuss any concerns or risk factors for heart disease. Follow their recommendations for screenings and preventive care. By adopting these healthy lifestyle habits and managing risk factors, you can significantly reduce your risk of experiencing a heart attack and improve your overall heart health. After all, prevention is better than cure. In the next segment, we will discuss the role of reflexology in heart attack recovery, so keep watching. After discussing the critical steps in surviving and recovering from a heart attack, let's divert our attention to a complementary therapy that might be beneficial during the recovery process. Reflexology. Reflexology involves applying pressure to specific points on the feet, hands or ears, promoting relaxation, improving circulation, and supporting overall well-being. However, it's important to note that while reflexology can contribute to a stress-free environment and potentially aid recovery, it is not a substitute for medical treatment. In the context of a heart attack, it's essential to prioritize emergency medical assistance. Attempting reflexology or other alternative therapies should not delay seeking immediate medical treatment. Once you're on the recovery path and with your healthcare provider's approval, you may consider reflexology as part of your rehabilitation. Its potential benefits for relaxation and stress relief can be a supportive factor in your journey towards a heart-healthy lifestyle. Remember, though reflexology may play a role in the recovery process, it is not a primary treatment for heart attacks. Always prioritize emergency medical assistance and follow the advice and recommendations of your healthcare providers for ongoing care, rehabilitation, and prevention of future heart problems. As we approach the end of this educational journey, I'd like to take a moment to express my sincere gratitude for your time and interest. It has been a pleasure sharing this vital information about heart health and wellness with you. Your comments, thoughts, and personal experiences are invaluable to us, so don't hesitate to leave them in the comment section below. By sharing this video with your loved ones, you might just inspire them to embark on their own health journey. Remember, staying informed and educated is the first step towards a healthier, happier life. However, it's essential to note that the information provided in this video is intended for educational and informational purposes only. It is not intended to replace professional medical advice, diagnosis, or treatment. We all have unique dietary needs and health conditions, so before making significant changes to your diet or lifestyle, please consult with a healthcare professional or a registered dietitian, especially if you have underlying health conditions. Your health is your most significant asset, and it's crucial to make informed decisions under the guidance of professionals. Remember, there isn't a one-size-fits-all solution to health, and what works for one person may not work for another. Work with your healthcare provider to make the best decisions for your health. Use this information as a starting point, and remember to take action today for a healthier tomorrow. Thanks for tuning in, and in the meantime, keep an eye out for our next video. Until then, stay healthy, stay happy, and keep learning.